Yes. This antimicrobial drugs can inhibit the cell wall synthesis. So there are beta lactam and glycopeptide. So before that, this the injury to the cell wall is also happened due to the presence of lysozymes. So and also due to the presence of hypertonic environment. So for example, if we have 20% sucrose solution, in that we uh, so that 20% sucrose solution is also showing the formation of protoplast in hypertonic condition in case of gram positive organism, and in case of gram negative forming the spiroplast. If such a protoplast or spiroplast are placed in an environment of ordinate tonicity, they take up the fluid rapidly and swell and may explode. So this is how, with the help of the lysozyme and the uh, um, hypotonic environment, we can also damage the cell wall. Then yes, uh, then the inhibition of cell wall synthesis mm, involves cross-linking of peptidoglycan. Uh, the antibiotics are penicillin, cephalosporin, then this imipenem, astrinum, then this vancomycin. Then there are inhibitors which act in other step in peptidoglycan synthesis. For example, this cycloserine and this bacitracin. So here you can see the summary of antimicrobial agent affecting the cell wall synthesis. Uh, so these are the inhibitors: beta lactamase antibiotic, and where you can see penicillin. The number of penicillin, the beta lactamase antibiotic are present here: amoxicillin, ampicillin, then this piperacillin, then cephalosporin. Uh, where there are first generation antibiotics, second generation, third generation, and fourth generation. Then there is a carbapenem. Here the meropenem is there. Then the monobactam. Uh, this as as trinonam. These are the beta lactamase antibiotic and other antibiotics. These are the beta lactamase inhibitor. Uh, for example, this lanic acid and this tazobactam. So first we will see the beta lactam antibiotics. So this all the all beta lactam drugs are selective inhibitors of bacterial cell wall synthesis and therefore active against growing bacteria. So this beta lactam having the beta lactam ring and inhibit the cell wall synthesis by binding to the penicillin binding protein PBP. This is the mechanism. This PBP uh, play a key role in the final stage of peptidoglycan synthesis. They catalyze the cross linkage of cell wall subunit, which are then incorporated into the cell wall. Then beta lactam are able to enter the cell through pore in the outer membrane of gram negative and bind to the PBP. It this uh, this prevent it from catalyzing the cross linkage of subunit, leading to their accumulation in the cell and release of autolytic enzyme which causes cell lysis. So this is the mechanism of beta lactam antibiotics.